with diabetes than in persons without.
Diabetes, if you attain good blood sugar levels quickly, that reduces your complication rate, reduces the incidence of large vessel heart attack, stroke complications, and small vessel complications, neuropathy, nerve damage, retinopathy, diabetes damage in the eyes, or nephropathy, diabetes damage in the kidneys, if you can achieve those blood sugar levels quickly. Once a complication has occurred, it's yours to keep, and we can only manage that complication. It's difficult to withdraw it. So it's very important to prevent complications by managing diabetes well early on.
Diabetes has significant or is a significant risk factor for atherosclerosis, promotes atherosclerosis or plaque buildup in the arteries throughout the body, but that includes the arteries of the heart. So it has a very definite role in terms of causing coronary artery disease and contributing to heart attack, also to stroke and
The role of the kidney. The kidney cleanses your blood, removes waste, produces urine, and erythropoietin for red blood cells. When your kidneys fail. Injury to the kidneys. Any accident that may cause harm to the kidneys, and acute renal failure. Diabetes causes damage to the nephrons. High blood pressure causes damage to the small blood vessels. And permanent kidney failure results in dialysis.
They have to be dialyzed 3 times a week, from anywhere from 3 hours to over 5 hours. And sometimes they come 4 and 5 days a week, depends on.
It's not uncommon for patients with diabetes and heart disease to also require dialysis or have kidney failure requiring dialysis. The same, again, it's the same disease process affecting the blood vessels of the heart can affect the kidneys and the small blood vessels within the kidneys, which is what leads to kidney failure and dialysis. And so
there's numerous foods like high potassium foods that they're not supposed to eat, and how to dialyze vegetables like potatoes, Irish potatoes, sweet potatoes, rutabagas, your fresh turnips, mustard, collards. They all have to be dialyzed in order to soak the potassium and some of the phosphorus out. And then they can only eat them sparingly. And then I have some of these. These are like high potassium foods that they need to avoid, like bananas, apricots, kiwi, fresh pear, nectarine, oranges, orange juice, and you can see it's a lot of foods that they can eat. Then I have one for like high phosphorus foods, like milk and cheese and dairy products. And then I have a handout for protein foods, the high biological protein foods that's good for them, and that way.
Insulin is a natural animal hormone. Its presence informs the body's cells that the animal is well fed. It causes liver and muscle cells to take in and store glucose in the form of glycogen. Insulin can be administered by subcutaneous injections, which is the most common, inhalation, and insulin pumps.
I take Lantus, which is a 24-hour insulin, every morning and every evening. And then I take Humalog when I eat meals. And then I also take Altace every evening before I go to bed.
It's sold in vials where the patient would draw it up in a syringe and inject it subcutaneously into their body. They also make pens which dial up the dose for them, and it's again injected. And they also make insulin pumps, which is a little pump that has a little needle that's in their subcutaneous layer, and
The human body always tries to keep its blood sugar in a very narrow range. It is able to accomplish this with the hormones insulin and glucagon, which are both secreted from the pancreas. It is the production of these two hormones that ultimately dictate whether someone suffers from diabetes or hypoglycemia. These two hormones are secreted in response to blood sugar levels, However, they react in opposite ways. The stimulus that causes the production of insulin is a high blood glucose level. Insulin is always produced in small amounts, but as blood sugar rises, so does the amount of insulin the body produces. In response, cells such as muscle, fat, and red blood cells absorb glucose from the blood to lower the high glucose levels in order to achieve a blood sugar within the normal range. However, if the blood glucose of the body begins to fall, the production of insulin also begins to taper off. The body desires a normal glucose level to be between 70 and 110.
The management post-operatively, there is an increased risk of wound infections in diabetics after cardiac surgery, and we know that poorly controlled diabetes in the immediate perioperative period is a risk factor for complications or bad outcomes with cardiac surgery. So
the main goal for diabetic medications is to reduce blood glucose levels when they reach a critical point. Type 1 diabetes is treated with a variety of insulin drugs, exercise, and diet. Type 2 diabetes can only be treated with diet and exercise. Medications for type 1 diabetics are designed to increase insulin output by the pancreas, decrease the amount of glucose released from the liver, increase the sensitivity of cells to insulin, decrease the absorption of carbohydrates, and slow the emptying of the stomach into the intestine to slow down absorption of carbohydrates in small intestines. What's given is only a sample of treatments available to diabetics. Every day, new treatments are being tested and made to treat diabetics.
Okay, first off is insulin, and that lowers the amount of blood glucose. Then there's your oral diabetes agents, and they work in a number of different ways to keep the blood sugar, normal. And there's also new medications. There's an inhaled insulin, newly available. It's been out for about a year, and there's also
the inhaled insulin. The barriers to absorption are mucus and the airways. If the patient's airways are hypersensitive from smoking or past work exposures where they have lots of inhalation irritants, the absorption level is not as controlled. But it's good for patients that need minimal amounts of insulin. Those early diabetics that are producing some insulin but not enough for their size. A lot of what we see is insulin production still is occurring in these diabetic patients, but the obesity has increased their size, so the surface area and the quantity that insulin has to work on is bigger. So the inhaled insulin works for those types of patients where they're still producing a little bit of insulin, or they're producing insulin and it's just not enough for their body size.
The cost varies quite widely. It's from about anywhere from in the $10, $20, $30 range, all the way up to a few $100s for the newer medications.
Thanks.
Toxins and waste products are removed from the blood through dialysis. Excess fluid is removed from the body in the form of urine. If kidney disease is suspected, doctors can run tests. An excess of any chemicals which should normally be removed from the blood by the kidney can signal a kidney disorder. A dialysis machine mixes and monitors the dialysate that helps remove the unwanted waste products from the blood. The dialysate is a mixture of an acidified solution, bicarbonate, and purified water. The dialysis machine uses the acidified solution to help get the electrolytes and minerals to their proper levels inside the body. While dialysate and the blood flow through the dialyzer without two solutions ever touching each other. The pumping action of the blood pump pushes the blood through the dialysers and back into the body. Fresh dialysate from the machine enters the dialysers throughout the treatment. Impurities are filtered out of the body into the dialysate. Dialysate containing unwanted waste products and excess electrolytes leave the dialysers and are washed down the drain. The machine monitors the flow of your blood while it is outside your body as well. If any level of solution becomes altered, an alarm sounds periodically to signal the things needed to be checked.
What the machine is doing is taking a bicarb mixture and an acid mixture, and that's what we call dialysate. This is what actually is mixed with the blood, and it goes through the filter, or the dialyzer, artificial kidney, whatever you want to call it, and that's where the impurities are actually extracted. In that process, whatever is being collected by the dialyzer, and this is the part you probably don't want to accept, is going to drain. We don't have, and no other medical facilities that I know of, we don't have a certain place that all of our waste goes. It goes into city water.
Some non-medical precautions to take when diagnosed with diabetes are explained in this slide. First of all, it is important to ensure that each day consists of a balanced meal in the right proportions to ensure that glucose levels are constant. It is important to focus more on low carbohydrate foods and focus more on vegetables, whole grain foods, fiber-rich foods, and fruits. Secondly, it is important that patients exercise regularly to reduce weight, as most diabetic patients are severely overweight. Thirdly, it is important that patients check their glucose levels periodically. The diagram to the left shows the food pyramid separating the different food groups necessary for a balanced diet. Finally, it is very important that diabetic patients stay self-motivated to practice these non-medical applications alongside medical applications.
We've had the distinct pleasure of having a number of people in the store who are diabetic. We offer a line of shoes that are designed specifically for diabetics because they have no seams in them, so that the chances of getting blisters are much more reduced. However, as long as you properly fit a shoe for someone who has diabetes or anyone else, then the shoe is more enjoyed. And we have certainly seen the improvement in their health along the way because they are now being active, and it helps them control their situation much better. I would strongly suggest train smarter, not harder. For many people, no pain, no gain is their motto, and I disagree with it. Vince Lombardi was great in motivating football players, but most of them were hurt. The train smarter, not harder method is to start with an incremental increase, and what you're looking for there is that you start slow and easy, and you work your way up. Rest is very important. And the rule of thumb is approximately you do not increase from 1 week to the next more than 10% of what you did the week before. In simple terms, if you walked 10 miles 1 week, then 10% of that is 1 mile. The next week you do no more than 11 miles. In this fashion, your body, your bones, your ligaments, your tendons, your muscles, and throughout your body are getting warmed up, and they are getting incrementally increasing the stress, therefore they can handle it. If you go from 10 miles 1 week to 35 miles the next week, I can pretty much guarantee you will be broken down by the third week. And we want people to continue their activities and not be stopped. Nutritionally, having interviewed the Valdosta school system and the Lowndes school system, I'm aware that their nutritional, the dietary items that they offer for the school for lunches and breakfast far exceed the state's requirements, which exceed the national requirements. Check your blood sugar, take your medication, eat right, and exercise. Those are the best things that you can do.
We would like to thank Dr. Lynn Feldman, Dr. Janice Loeffler, Dr. Trey Powell, Maria White, Allison King, Dr. Jennifer Lawrence, Dr. Bolin Woodward, Anna Zipperer, Todd Smoot, Frida Johnston, Greg Keene, Chris Beam, Mr. Mitchell, and the Valdosta State University Media Center.